Good evening. The COVID-19 pandemic, with its physical and mental health consequences, has challenged a great proportion of our population. It has also led to a dramatic loss of human life worldwide and presents an unprecedented challenge to our public health and the world of work. In this scenario, it is very important to have an awareness on the COVID-19 virus, myths surrounding it, its symptoms, treatment, transmission, importance of information sources, and rehabilitation. We are very privileged to have with us today Dr. Balamurali, Managing Director Hamsa, and the head of spine surgery at Kaveri Hospital, Chennai, to talk to us on COVID 19 awareness. Dr. Balamurali is an internationally trained spinal neurosurgeon with 24 years of surgical experience, 15 years from UK, and after that from India. He is extensively trained in all the aspects of spinal surgery with several fellowships from UK, USA, and Switzerland. He's a senior spine and neurosurgeon in India since 2011. He's the managing director of Hamsa, which is a brain and spine center, the first ever top notch surgery rehabilitation center in Chennai. He's a Rotarian who has done several projects like Rashtra, which is awarded by the former president, late Dr. APJ Abdul Kalam, and many more projects as a service to humankind. He is also a fitness enthusiast, a trekker since 2013. He specializes in pencil art and portraits. He's a marathon runner and a cyclist. He owes his success and accomplishments to his wife, Dr. Vanilla, and his two daughters. We are very happy to have you with us today, Doctor. On behalf of everyone present here, I extend a very warm welcome to you. Now over to you, Dr. Balamurali.
Thank you very much. Um, Let me just share my screen. Okay. Can you see that? And can you hear me?
Yes, sir.
Okay. Thank you very much to Mr. Kumar Rajendran for this invitation. And thank you to all the staff for making time to listen to me and inviting me. First of all, I'd like to stress and emphasize that my talk is going to be something that you all know about because it's been in the media, it's been discussed, talked, debated everywhere for the last 1.5 years. Most of you are probably fed up with listening to COVID-19. But today's talk is going to be trying to give you some very basic information which some of you may not know, and some important information about what is expected, what is going to happen in the future, and a lot of emphasis about the vaccination program. So please listen for the next 20 minutes to 30 minutes, and then we'll have some time for question and answers. So I've called this talk as COVID 2.0 because this is the second wave that we are having. And there is a lot of discussion about 3.0 and 4.0 as well. So it's very important that you try to know what this is and why it's very important to be very, very careful. Now, I want to start off with my own story, and I'll tell you why I want to share my story. So about a month and a half ago, I was at this place. This is Kanchenjunga Peak. It's at 16,000 feet, so I trek a lot, so I was up there. It was beautiful. It was a small window of period from the COVID break, and I made use of this opportunity with a group of friends. So that's me there at 16,000 feet at minus 16 degrees. I thought I was fit and healthy. I survived COVID, and I was very happy and pleased about my accomplishment. Came back, returned. 6 days after I returned, I was COVID positive. I had taken both vaccines, and I completed my vaccination almost 2.5 months before I developed COVID. Fortunately, I just had a bit of runny nose, cold, a little bit of body pain, and some uneasiness. But apart from that, it was just a good 10 days break from work. As you all know that most doctors, we've been busy during this COVID. Either we were working for COVID or trying to assist people who had COVID in some way or the other. So this 10 days was a kind of a break for me. The reason I want to emphasize about this, I will tell you as we go along. So when I came back from my trek, the COVID was on the rise, which was on the 10th of April. The cases were slowly going up. And ever since then, the cases significantly went up, and only now you can see that this curve is coming down. So compared to our first wave, which was a very gradual peak and a gradual decline, this was a sudden peak and a sudden decline. That's why I call this 2.0. It has come with a vengeance, and it has rose very shortly over a period of 2 weeks, and it is coming back also quite nicely. Now, if you look at the number of deaths as well, it has been significantly high compared to per million population. And probably we are one of the countries in the world with number one number of cases in surge. And case per million as well, we were somewhere way down in that graph, but we have come up. And if we have more waves, we will be number one in the world to have the most number of cases. The daily new cases also, we are the highest, and we are slowly coming down. And if you look at the confirmed cases per million, compared to other countries, we are number 2, next to the United States. Now, I just want you to understand a little bit about the COVID virus and the COVID disease. நிறைய பேருக்கு இதை பத்தி தெரியும், but I just want you to see this short video which explains about what this virus is, what it does to your body, and why is there so much hype? Because everybody says it's only a simple cold virus, a flu virus, an influenza virus. In the virus, sudden, there is an different reaction because everybody gets common cold, everybody gets a flu, but how come this flu virus is very different, causing so much of death and disease? So let's just watch this short video for 2-3 minutes.
Must infect living cells in order to reproduce. Let's have a closer look. Inside the virus, genetic material contains the information to make more copies of itself. A protein shell provides a hard protective enclosure for the genetic material as the virus travels between the people it infects. An outer envelope allows the virus to infect cells by merging with the cell's outer membrane. Projecting from the envelope are spikes of protein molecules. Both a typical influenza virus and the new coronavirus use their spikes like a key to get inside a cell in your body, where it takes over the cell's internal machinery, repurposing it to build the components of new viruses. When an infected person talks, coughs, or sneezes, droplets carrying the virus may land in your mouth or nose and then move into your lungs. Once inside your body, the virus comes in contact with cells in your throat, nose, or lungs. One spike on the virus inserts into a receptor molecule on your healthy cell membrane like a key in a lock. This action allows the virus to get inside your cell. A typical flu virus would travel inside a sac made from your cell membrane to your cell's nucleus that houses all its genetic material. The coronavirus, on the other hand, doesn't need to enter the host cell nucleus. It can directly access parts of the host cell called ribosomes. Ribosomes use genetic information from the virus to make viral proteins, such as the spikes on the virus's surface. A packaging structure in your cell then carries the spikes in vesicles, which merge with your cell's outer layer, the cell membrane. All the parts needed to create a new virus gather just beneath your cell's membrane. Then, a new virus begins to bud off from the cell's membrane. Must infect.
So this is the difference between a lot of other viruses, that it breaks many barriers, and this virus can replicate very fast. The first wave virus was very different from the second wave virus because it has mutated and it has found a lot of shortcuts to multiply. And that's why the symptoms also are much quicker and faster. Now let's just look at, the virus history. We know that it started from Wuhan in December 2019, but in the last 6 months, we've heard nothing from China. And the WHO declared a pandemic in March 2020. The common symptoms that patients have are fever, cough, sore throat, fatigue, shortness of breath. But typically, this is not seen in everybody. Especially the second wave, more and more people have had abdominal pain, diarrhea, vomiting, uneasiness, fatigue, body pain, along with sometimes fever, maybe not that much sore throat, maybe not that much of breathlessness. The symptoms start from day one after exposure, but it can last as long as 2 weeks. Usually, by the 5th to 6th day, you get symptoms. But in the second wave, people have had symptoms as early as 2 to 3 days. As I said, other symptoms are, simple diarrhea, vomiting, rash, headache, and so many other things people have had. Now, if you look at the severity, 81% of people have very mild disease. 14% of them have disease that require oxygen therapy. Only 5% of people need to go into the intensive care, of which only about 1% of people really they do die. Now, the many patients recover fully in about 2 weeks' time. In others, some symptoms like breathlessness, fatigue, may continue for several weeks to months, sometimes up to about 1 year. People have various other symptoms. Now, the mode of transmission, we all know it's a direct method or an indirect method. So the indirect method is where they have cough, sneezing, they have infected droplets. Through the droplets, they can spread from the surface, from the tables, from the door handles, from the lift buttons. So from anywhere you touch, this virus can live up to nearly 2 days to 3 days. If you look at how the transmission happens, the virus that was spreading very fast was the measles virus, where one person can infect up to 18 people. The wave 1, the virus can infect up to 4 people, but in wave 2, it has infected up to 8 to 9 people, which means the second wave was very, very severe. Now, the talk is about the third wave. The third wave, they say, is going to infect younger people, children. It is true because they are the ones who are not going to be vaccinated. And most other people would have been vaccinated and they would form as a barrier. But they also feel there are going to be multiple waves, like a third wave, a fourth wave, a fifth wave, but they're all very short and the virus can spread very quickly and come down very quickly by locking down, isolation, and various other things. So we don't know, but definitely there is a lot of speculation about a third virus between September and November this year. So how do we diagnose this? There are 2 tests that we do. One is a rapid test and one is an RT-PCR. The rapid test is not very diagnostic. It is not very safe. The RT-PCR is one of those tests that is very sensitive, and that is what everybody does. The diagnosis is fairly simple and straightforward by giving a sample from your nose or throat. But remember, if you have symptoms, if your CT scan shows findings, and if you are negative, it does not mean you're negative. Only 85 to 95% of this test is sensitive. So 5% people, even if you have symptoms, you may still turn out to be negative. So you have to compare the symptoms with the test. If you have a lot of cough, cold, fever, body pain, very typical of corona, and if your test is negative, don't think, oh, don't get back to normal. You still can have corona. So it's very important to compare the symptoms as well as the test results. Treatment, there is no treatment. All the medicines that we are talking about are only in the trial phase, whether it is remdesivir or antiviral drugs or so many new drugs, plasma therapy, monotherapy, monoclonal therapy. So many therapies are all coming. Nothing is shown that it works for everybody. 2020, the most popular words have been face masks, stay home, wash your hands, sanitizer, social distancing. This is the treatment. The treatment for the coronavirus at the moment is all of these. Wearing a face mask. The face mask not only reduces the risk to the wearer, but also spreading the virus. So you're not only inhaling, but you're also not going to spread the virus to others. So now the question is everybody going to get? Yes, from a newborn baby till a 95-year-old, everybody is exposed. Nobody is immune to this unless you had the infection. And as I said, even if you had the infection, even if you are vaccinated, you can still catch the virus. I had the vaccination on time, and 2 months after I had the vaccination, I still had the disease. But I'll tell you why I had a mild symptom. There are also people I know who had the infection, recovered, they had the vaccine, they got better, and again they have had the infection. So just because you're vaccinated or just because you had the virus before does not mean that you will not catch the virus the second time or even the third time. So people at high risk are elderly people. ஏன் பார்த்தீங்கன்னா அவங்களுக்கு their immunity is less, they are older, their lung capacity, their body, heart, lung எல்லாமே is a bit weaker. So that is why elderly people are more at risk. People who have heart disease, diabetes, lung problems, kidney problems, cancer treatment, drugs, steroids, AIDS, lung complications, இவங்களுக்கு எல்லாருக்குமே the risk is very, very high. One of the constant risks that we have seen is uncontrolled diabetes, not normal diabetes, but uncontrolled diabetes. Pregnant women, there is a lot of caution. But now I'm sure most places you will be seeing, and a lot of television, you must be watching the news. Most countries have started to vaccinate pregnant women also, because they feel that the risk of the disease is more than is less than having the vaccination. So very important that we get the vaccine done even for pregnant people. So if you look at how you can divide the cases, as I said, 80 to 90% of people will get only mild to moderate. Mild na konja fever, konja cough, body pain, sometimes the temperature is high. In the second wave, the temperature has been very high in many patients. Some shortness of breath, இதெல்லாம் இருக்கும். The saturation must be above 94 and they are able to breathe nicely. Moderate disease, the temperature is slightly more breathlessness, the saturation is about 90-93, and severe disease means they have severe lack of oxygen. So the mild disease, they can stay at home. Home quarantine is more than sufficient. You do not need to do anything else. You can just stay at home quarantine. What do you do at home quarantine? You stay at home, you're monitored by somebody. Maintain social distancing, do not mix with anybody in the house, make sure you don't come out of a room, your utensils, your clothes, your brush, your toilet, nothing should be shared with anybody. If you don't have that facility, if you feel that உங்க வீட்ல தனியா இருக்க முடியாது, டாய்லெட்டை எல்லாரோடையும் ஷேர் பண்ணணும், கிச்சன் டைனிங் ரூம் தனியா கிடையாது, சாப்பிட்றது எல்லா இடத்துலையும் தான் சாப்பிடணும் அப்படின்னா, go and stay in a hotel or some quarantine center. Do not stay at home. If you are going to quarantine inside the house, you have to be completely isolated inside a room for 10 days. People who are going to look after somebody who's quarantined, you make sure that you don't go inside, you don't feed them, and if you're doing, you have to make sure you're well covered, double mask, and protect yourself. You should not share anything with them. Mild disease and severe disease, leave it to the doctors to decide. You must go to a hospital. If your saturation is below 92-93, you must go to hospital. If your heart rate and respiratory rate is very high, you must go to hospital. I am not going to tell you what they will do in hospital. The doctors will take care. Just go there. Sometimes you may need just oxygen. Sometimes you may need high flow oxygen. Sometimes you may need ventilator. Remember, 99% people are going to survive. Only 1% of people are going to die. So do not panic, do not worry. Even if you have saturations low, 99% of them are still going to get better. Now, I want to show you this video where I'm going to show you why this disease is quite bad in some people and why it is not so bad in other people. Yeah, so let us just look at this short video.
Spreading in your body. How can you develop pneumonia symptoms?
Why some people develop severe disease?
We'll have to look into your lungs. Each lung has separate sections called lobes. Normally, as you breathe, air moves freely through your trachea or windpipe then through large tubes called bronchi, through smaller tubes called bronchioles, and finally into tiny sacs called alveoli. Your airways and alveoli are flexible and springy. When you breathe in, each air sac inflates like a small balloon. And when you exhale, the sacs deflate. Small blood vessels called capillaries surround your alveoli. Oxygen from the air you breathe passes into your capillaries, and then carbon dioxide from your body passes out of your capillaries into your alveoli so that your lungs can get rid of it when you exhale. Your airways catch most germs in the mucus that lines your trachea, bronchi, and bronchioles. In a healthy body, hair-like cilia lining the tubes constantly push the mucus and germs out of your airways, where you might expel them by coughing. Normally, cells of your immune system attack viruses and germs that make it past your mucus and cilia and enter your alveoli. However, if your immune system is weakened, like in the case of a coronavirus infection, the virus can overwhelm your immune cells, and your bronchioles and alveoli become inflamed as your immune system attacks the multiplying viruses. The inflammation can cause your alveoli to fill with fluid, making it difficult for your body to get the oxygen it needs. You could develop lobar pneumonia, where one lobe of your lungs is affected, or you could have bronchopneumonia that affects many areas of both lungs. Pneumonia may cause difficulty breathing, chest pain, coughing, fever and chills, confusion, headache, muscle pain, and fatigue. It can also lead to more serious complications. Respiratory failure occurs when your breathing becomes so difficult that you need a machine called a ventilator to help you breathe. These are the machines that save lives and that medical device companies currently ramp up production for.
So some people develop pneumonia and become very bad because if your immune system is not able to attack this virus, all these small pockets of air that's inside your lungs, they get filled with fluid, they get inflamed, the oxygen exchange does not happen, and so the patient slowly, gradually gets worse. So we have to be very, very watchful about this and very careful about this. Now, when to seek hospital care? Who are the ones who should go into hospital? So if you're positive, even if you're negative, if you have an oxygen saturation less than 94, if you are feeling it difficult to breathe, toilet kuda endichu nadakka po mudiyala, high fever, continuous fever vandute irukku, continuous cough, you're not able to eat, swallow, you're very agitated, anxious, or if you're above 60, you have all kinds of medical problems, your chest x-ray showing changes, and if all your blood counts are not normal. So these are all reasons why you must definitely go into a hospital as soon as possible. So after that, what happens in hospital, as I said, leave it to the doctors, they will take care of it. But we will come to some of the interesting things that's really debated now. Now, the next question is, I'm going to talk to you about vaccination. In the vaccination, பத்தி என்ன ஒரு interesting thing பார்த்தீங்கன்னா, நம்ம போன வருஷம் ஃபுல்லா what were we thinking? ஐயோ எப்படா இந்த லாக்டவுன் முடியும், எப்ப இந்த கொரோனா வைரஸ் போகும், எப்ப we will find an treatment, எப்ப வேக்சின் கண்டுபிடிப்பாங்க, எந்த கண்ட்ரி ஃபர்ஸ்ட் கண்டுபிடிப்பாங்க, இந்தியா கண்டுபிடிக்குமா, நமக்குலாம் வேக்சின் சீக்கிரம் கிடைக்காதா. So these were all the anxieties that we had last year. But இந்த வருஷம் என்ன anxiety? Vaccine வந்துருச்சு. There are nearly about 7 companies that have produced vaccine. 2 major productions are in India, but nobody wants to take the vaccine. They're all worried, இந்த vaccine நல்லதா, கோவேக்சின் போடலாமா, கோவிஷீல்ட் போடலாமா, vaccine போட்டா வந்துருமா, vaccine போட்டா அவங்களுக்கு இப்படி ஆச்சு, media, WhatsApp, messages, advocacies from people. Everybody is now afraid of the vaccine. But why? இவ்வளவு வருஷமா இந்த எல்லா வேக்சினும் நம்ம குழந்தைங்களுக்கு டாக்டர் சொன்னதை போட்டுக்கிட்டோம் இல்லையா? பட் இந்த வேக்சின் மட்டும் ஏன் திடீர்னு everybody has got so many questions. So I'm going to answer some of all the questions. So why is a vaccine needed? So the vaccine reduces the risk of infection as it is a public health problem. Because if you are protected from the disease, then you are not going to spread it to someone else. It reduces the risk of severe disease. As I said, I had the infection, but I had the vaccine. So maybe because I had the vaccine, my disease didn't go to my lungs. I did not have any significant problems. Majority of people who got admitted this time in ICU and who died are people who did not have the vaccine. If they had been vaccinated, if they had taken the vaccine earlier, they could have survived. Yeah. So very, very important. The vaccine protects death. Vaccine protects the severity of the infection. So please do get vaccinated. It has a lot of long-term effects. And it also prevents transmission. It is our responsibility to stop the spread of infection. So those who have vaccine have less virus, it's more in the throat, and the less chance of you spreading it to others. So if you look at in India, first dose மட்டும் எடுத்திருந்தா you're almost 40 to 60% protected. ரெண்டு டோஸும் எடுத்திருந்தா you're almost 80% protected. So who should not have vaccine? Only if you have an allergic reaction of skin to milk products to anything specific. அதுவும் if the allergy did not require hospitalization, if the allergy was very mild, எனக்கு ஒரு mild dust allergy இருக்கு, அதுக்கெல்லாம் ஒன்றும் ப்ராப்ளம் இல்லை. நான் என்னைக்காவது நான் இதை மாத்திரை சாப்பிட்டா எனக்கு வயிறு கலக்கி அலர்ஜி ஆகும். That is not. If you had a serious allergy, then you cannot take the vaccine. But discuss that with your doctor. All other patients, majority of patients can take the vaccine. Other people who cannot take vaccine, if you had a COVID infection, 3 மாசத்துக்கு you cannot take the vaccine. So if you had a recent COVID infection, you cannot take vaccine. If you have active COVID, you cannot take vaccine. If you had monoclonal antibodies, you cannot take vaccine. And if you are actually unwell and hospitalized because of any serious medical problem, if you have a kidney failure, heart attack, stroke, இந்த மாதிரி ஏதாவது சீரியஸ் பிரச்சனைகள் இருந்தா then you cannot take the vaccine. So everybody else should take the vaccine. Now I'm going to tell you what actually this vaccine does. So this vaccine actually has been, in the market. It has been, produced well. So let's see how this
versions of the virus
actually
from different approaches for a potential vaccine against the coronavirus. The basic idea is that you would get a shot that contains faint versions of the virus. The vaccine would expose your body to a version of the virus that is too weak to cause infection, but just strong enough to stimulate an immune response. Within a few weeks, cells in your immune system would make markers called antibodies, which would be specific for only the coronavirus, or specifically its spike protein. Antibodies then attach to the virus and prevent it from attaching to your cells. Your immune system then responds to signals from the antibodies by consuming and destroying the clumps of viruses. If you then catch the real virus at a later stage, your body would recognize it and destroy it. In other words, your immune system is now primed. Collecting evidence on whether this will be possible, safe, and effective is part of what's taking researchers so long to develop a vaccine.
So this vaccine, இதை பத்தி கொஞ்சம் பேசலாம். But before that, I want you to see the statistics about how in this world we are doing in terms of vaccine. So the vaccine doses administered, if you look at worldwide, countries like the UK, USA have all been vaccinated. If you look at, the number of vaccine doses administered per 100,000, we are very, 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 very small. If you look at population who have been fully vaccinated, again, certain countries in Europe, certain countries in the US are more than 60% of their population is vaccinated. India, at the moment, as of June 2nd, only 12% of population is vaccinated. Number one, we do not have enough vaccines. The government is still trying to procure vaccine. Number two, people don't want to take the vaccine. At one point, people were all being called to take the vaccine and everybody refused. But now people know after the second wave that they should have taken the vaccine and they probably missed the chance, are now waiting for vaccine. So at least people who have taken one dose, again, is around 12%. So if you look at, the vaccine doses administered, again, it is very, very small, 0.1%. So total daily doses available are about nearly, 1.82 crores of vaccination are being done. and it's going to take a long time for us to get vaccinated. If some of the questions are in the vaccine வந்து கண்டுபிடிச்சு இவ்வளவு சீக்கிரம் கண்டுபிடிச்சிட்டாங்க within 1 year, how can they produce vaccine? Normally it takes anything between 5 to 10 years to develop a vaccine. So did they do the proper test? Did they do the proper trial? Did enough people get vaccinated? So there are various phases in which the trial happens. Phase 1, phase 2 and phase 3 is mandatory. First on the animals inject பண்ணுவாங்க, அப்புறம் humans, then they look at side effects, efficacy. This also went through all those phases. The only thing, this vaccine has been developed the most quickest vaccine in the world because all countries got together, the law was changed very quickly, there was plenty of money pumped in from various countries, and we are technologically very advanced. So that is why we were able to produce this vaccine in less than 1 year. Can you get COVID from vaccination? No. The virus is a dead virus. The dead virus protein is only used. So you cannot get corona from the vaccine. If you already had COVID-19, should I get vaccinated? Yes. The vaccine does not protect you for life. The efficacy starts dropping after 6 months to 1 year. There may be a booster dose that may be recommended in the future. அதனால கண்டிப்பா கொரோனா வந்திருந்தாலும் 3 மாசத்துக்கு போட முடியாது. But after 3 months, you must take the vaccine. Some people think they are very young. They won't get the virus. It can affect from the newborn. So in the UK, the trial is going on for younger children. So everybody needs to get vaccinated. Vaccine போட்டதுக்கு அப்புறம் மாஸ்க் தேவையில்லை, எனக்கு இனிமேல் வராது, you will get it. You can get it. So you still have to wear the mask because even if you get it, you have to stop it from spreading to others. People with underlying conditions, now already sonna madri, if you have more medical problems like sugar, BP, heart attack, stroke or anything, you are the one who should get first vaccinated before the healthy person. Is not again, not working for new variants. Yes, we don't know about new variants. Pudu variant varappo pudu vaccine varum. Side effects, the only side effects you will get is 1 or 2 days fever varla, chills varla, you can have body pain, some headache, joint pain, oosi pota edathila vali varum. But apart from this, there are no serious effects, so you should take the vaccine. As I said, compared to all other countries, we are way down at around 12% of our population is vaccinated, whereas countries like Israel, UK, are all been vaccinated almost 50-60%. So the next question is which vaccine to take? Covaxin or Covishield? Both vaccines, they work in a different method. The way that they are produced is different, the lab that they used is different, the technology is different, but the end result is the same. Both of them stimulate the immunity of the body. அதனால எது கிடைச்சாலும் போட்டுக்கோங்க. There is nothing that is superior or inferior. Both vaccines are taken worldwide. I had Covishield, my family has had Covishield, my relatives had Covaxin. Everybody is at the same risk of developing the disease. Sputnik அப்படிங்கிற Russian vaccine is also now come in the market in India, and that is also produced in exactly the same way as Covishield vaccine. Pregnancy and breastfeeding, until recently there was confusion. They thought that it will harm the baby, but people have now started to take vaccine. International law has changed. In America, the WHO has said, the Indian government has still not confirmed, but still now a lot of hospitals, including Kaveri, Apollo, all hospitals are giving vaccination for pregnant women and for breastfeeding women. For children, at the moment, there is a major trial that's gone in the UK that is complete, and from last week, they have been successful in finding that it is effective in children. So, India, most likely, அடுத்த வருஷம் வரும், we will be vaccinating all children about 12 years to 18 years also. இப்போதைக்கு இந்தியால இல்ல, but in future it will come. Elderly people definitely must get vaccinated. இப்போ அடுத்த கொஸ்டின் வந்து நிறைய பேர் அவங்களே போய் சிடி ஸ்கேன் எடுத்துட்டு எனக்கு கொரோனா இருக்கான்னு கண்டுபிடிச்சிக்கிறாங்க. ரிமெம்பர், சிடி ஸ்கேன் will show if there is any problem, but it is not going to change the way you are treated. Hospitals also, smaller hospitals, unfortunately advocate CT scan. CT scan is not necessary for everybody. Remember, CT scan is very, very high radiation. It can cause cancer. One CT scan is equal to taking 300 X-rays because it's the same amount of radiation. Is there a cure? நம்ம எல்லாரும் பார்த்துப்போம் ஒரு மாசத்துக்கு முன்னாடி இந்த ரெம்டிசிவியர்னு ஒரு மருந்துக்கு கியூல நின்று ஐம் ஷூர் சம் ஆஃப் யூ ஆல்சோ மே ஹேவ் திஸ் எக்ஸ்பீரியன்ஸ். ஸோ ரெம்டிசிவியர் இஸ் அன் ஆன்டிவைரல் ட்ரக். It is not a cure. It does not prevent death. It does not prevent disease progression. It does not stop lung involvement. There is no evidence that remdesivir is very effective. In a very small group of patients, if they come early to hospital, there is some benefit. அதனால ரெம்டிசிவிர் கிடைக்கலன்னா அதனால சரியாகலை அப்படின்னு நினைக்க வேண்டாம். If somebody felt that you lost a member in your family or someone because you didn't get remdesivir, it is not true. Remdesivir does not prevent death. And now a remdesivir has actually in the vaarathilirundhu has been taken away from the WHO guidelines for as a drug of treatment for corona. So அதனால remdesivir இனிமேல் யூஸ் பண்ணக்கூடாதுன்னு இன்டர்நேஷனல் கைட்லைன் சொல்லுது. So do not trust this drug. Reinfection வரலாமா? கண்டிப்பா வரலாம். Even if you are vaccinated, you can get it. So there's a lot of other myths about the mask. என்ன மாதிரி மாஸ்க் போடணும்? சிங்கிள் மாஸ்கா, டபுள் மாஸ்கா? We are talking now more and more about double masking. So yes, double masking is important because the cloth mask that you all wear, எல்லாரும் நீங்க ஃபேன்சியா உங்க பிளவுஸ் சாரிக்கு சுடிதாருக்கு மேட்சிங்கா எல்லாரும் இப்போ வந்து மாஸ்க் போட ஆரம்பிச்சிட்டீங்க. These masks do not protect you from the spread of infection, either to others or from you getting it. So அதனால you must wear a double mask. You must wear a surgical mask. On top of that, உங்க designer mask போட்டுக்கலாம். But do not wear only your designer mask and go outside because it does not protect you. Immune boost, நிறைய நம்ம இதை பற்றி படிச்சிருக்கோம். போன வருஷம் ஃபுல்லாக நம்ம டைம் ஸ்பெண்ட் பண்ணதே இதில் தான். எந்த ஆயுர்வேதிக் மருந்து சாப்பிடலாம், கபசூர குடிநீர் குடிக்கலாமா, மஞ்சள் எடுத்து பூசிக்கலாமா, சுடு தண்ணி குடிக்கலாமா. So there's so many myths that are there. And we all were also taking malaria tablets initially at one point. So none of these have been beneficial. Wearing a mask and jogging is not advisable. Antibiotics is not the treatment, it's a viral infection. Does having corona affect older people? Yes. Older people and children are more susceptible, so they should be vaccinated. People thought that வெயில் காலத்துல வைரஸ் செத்து போயிடும், குளிர் காலத்துல வைரஸ் செத்து போயிடும். வெயிலும் did not affect the virus, குளிர்காலமும் did not affect the virus. போன சம்மர் வந்துச்சு, இந்த சம்மரும் வந்துட்டு போயிடுச்சு. Some people have this fear that ஒரு கொரோனா பேஷண்ட்ல இருந்து கொசு கடிச்சு நம்மள கடிச்சா வருமா? It does not spread through mosquitoes, bees, flies. நிறைய பேர் வந்து ஒரு நாளைக்கு 3 தடவை குளிக்கிறாங்க, மவுத்ல கார்க்லிங் பண்றாங்க, ஸ்டீம் இன்ஹலேஷன். இது வந்து பிகம் அ லேட்டஸ்ட் ட்ரீட்மெண்ட். ஸ்டீம் இன்ஹலேஷன் பண்ணா கொரோனா வராது. ஸ்டீம் இன்ஹலேஷனுக்கும் கொரோனாக்கும் சம்பந்தமே கிடையாது. By doing steam inhalation, you are able to bring out the secretions from your lungs. So it helps to clear the lungs. It helps to reduce the viral load, but it is not a cure for virus, for corona. So you can have a good bath, you will clean your body, but it will not get rid of the virus. Cold weather also, it will persist. It can spread from one person to the other. இப்போ கையில தான் ஆல்கஹால் போட்டு கிளீன் பண்றோம், அதே ஆல்கஹாலை குடிச்சா நல்லா இருக்குமா அப்படின்னா, if you drink alcohol, it will only kill your liver. It is not going to kill coronavirus. So drinking alcohol is not a cure. It is not going to kill. இந்த மொபைல் சிக்னல் மொபைல் ஃபோன்ல எல்லாம் வருதுன்னு போன வருஷம் நிறைய பேசிக்கிட்டாங்க. ஸோ இட் ஹேஸ் நத்திங் டு டூ வித் தட். டேக்கிங் விட்டமின்ஸ் அண்ட் மினரல்ஸ் ஆர் ஆல் குட். தே ஹெல்ப் யூ வித் யோர் immunity, but again it is not a cure for COVID. You can wash your nose with betadine, nasal wash, எல்லாம் பண்ணலாம். garlic சாப்பிடுறது, onion சாப்பிடுறது. So all these things can protect from bacterial infection, viral infection, but it is not going to prevent COVID. Hot pepper, hot soups, இதெல்லாம் நிறைய பேர் காரம் நிறைய சாப்பிட்டா வைரஸ் வராது. Again, there is no proof. So all these myths are there. It's good to increase your immunity in whatever methods you want, but remember, protecting yourself from the virus is the only key. நிறைய ஸ்டிக்மா வந்துருச்சு நம்ம சொசைட்டில. அதாவது வாட் ஐ மீன் பை ஸ்டிக்மா இஸ் many people are looking at people who have had COVID. அவங்க கோவிட் வந்துருச்சு, கொஞ்சம் தள்ளி நிக்கலாம், அந்த ஃபிளாட்ல கோவிட் இருக்கு, அந்த ஃபிளாட்டுக்கு குழந்தைங்களை அனுப்ப வேண்டாம், பக்கத்து தெருவுல கோவிட் இருக்கு, இது அந்த வீட்டுல அந்த தெரு பக்கம் நடக்க வேணாம். So there's a social stigma that's developing at workplace also. People don't want to mix with somebody who's had COVID. Remember, COVID is only contagious for 1 or 2 weeks. It is not something like an HIV or any other infection that is there in your body and it can spread throughout. So this virus will go out of the body after 2 weeks. ஒரு நம்ம வீட்லயே கோவிட் வந்தவங்க அந்த வீட்ல அந்த ரூம் 2 நாள் பூட்டி வச்சிங்கன்னா the virus will die. ஒரு வாரம் கழிச்சு போனாலும் அந்த இன்ஃபெக்ஷன் வராது. ஸோ அதனால you need to be more inclusive and just be supportive of people with COVID. So same way is COVID is like a tsunami. வருது, ஒரு வாரம் இருக்குது, போயிடுது. In some people it causes no problems, they get totally better and they become fine. But in some people it actually causes a lot of damage. It can infect the lungs, the blood vessels la clot வருது, அதனால தான் heart attack வருது, stroke வருது, it causes brain in blood supply to the brain reduced, kidney க்கு blood supply கம்மியான kidney failure. பயங்கர psychological effects are there. People also who tend to stay in hospital for a long time, they have breathing problems, they are immobilized. 10 நாள் பெட்ல யோசிச்சு பாருங்க, படுத்துட்டு இருந்தா you will feel very, very weak, your muscles become weak. And people who are in ICU, they have chronic problems. So we are seeing more and more of people who are developing severe side effects and effects of COVID. If the lung is affected 50%, 60%, ஒரு வருஷம் அவங்க breathing problems இருக்கும். இப்ப ஹாஸ்பிட்டல்ல 2 வாரம் 3 வாரம் இருந்தா எந்திரிச்சு நடக்கிறதுக்கு 2 வாரம் ஆகும். If the lungs are severely damaged, you can develop breathing problem for up to 2 to 3 years. So இதுக்கு you need a lot of therapies. So this physical problems, which are fatigue problems, swallowing problems, severe sore throat for about 2-3 weeks, you lose weight by 5-10 kg, severe depression, anxiety, suicidal thoughts. Forget elderly people, they develop a lot of memory problems. So all this goes on for a long time. And 2 out of 3 people who are in ICU have problems up to 1 year. And 35% people suffer severe psychological depression and anxiety. This affects people more who are longer stay in hospital, older people, and people who have medical problems. So we at Hamsa, we provide a lot of rehabilitation for these people, and there's a significant amount of work that is going on, and we are visiting almost 4-5 hospitals and giving rehabilitation while they are in hospital during their COVID. On the stage liye avangalukku chest physio, walking, exercise idella panni they find it better to recover. So we have a team of doctors, therapists, and so many other people who provide these therapies, speech therapists, psychologists, dietitian. We improve their diet. So you need to focus on your diet for at least 1 or 2 months after you get the infection. How to breathe, what exercises to do to improve your lung capacity, how to manage your stress and fear, how to be mindful and do yoga exercises, and what is the diet plan that you can follow. And all these various therapies, a team of specialists are trying to help, and this is something that a lot of hospitals are focusing on now. But the benefits are you improve quickly, you can go back to work quickly, the chances of you getting readmitted to hospital, complications, all these are reduced significantly. So rehabilitation really benefits. So as I said, you cannot stop the spread of the infection, stop the side effects that take home. So the final take home message, really I wanted to say, the treatment for COVID is not there, but the treatment is wearing a mask or a shield, wearing gloves if necessary when you are going outside, social distancing, stopping the spread of infection, keeping the distance, avoiding crowds, washing your hand frequently, not touching your face, nose, and mouth. Because that's the only way you can save our country and you can save the world, because you're not alone. There's no country in the world that has not been affected. So everybody is involved and everybody is fighting this big pandemic. So seek help, don't delay. If there is any worry, the more you delay, the more chances of you getting more sicker and not being able to survive. We at Hamsa, we have a helpline. I think Mr. Kumar Rajendran has circulated these numbers, and we try to help you with all these things. Thank you once again. And if there are any questions, please feel free to ask. I mean, this is your opportunity to ask questions and find out. So I really want to emphasize that please do take your vaccination, encourage your family members and friends to take vaccination. A lot of us have seen our family, our friends, relatives, close people die. It is really sad, it is very depressing that we are unable to help them. Even with the best of treatment, the best of intensive care, if the lung involvement is significant, we cannot save them. The only way you can save yourself right now, apart from following social distancing, using face mask, is to get vaccinated as soon as possible. Thank you very much, and I'll be here for questions.
Thank you very much, sir, for the very informative session. If you have any questions, you may please share it in the chat box. We have one question. Yes. Yes, Nitya, ma'am.
Yes, ma'am. Thank you, sir, for structuring a perfect note on COVID as well as vaccination awareness. My question is, COVID patients who have been administered remdesivir or steroid, a spike in sugar level is noticed. So what is the possible effect of these on glycemic control? And adding more to it, recently, Dr. Randeep Guleria, AIMS chief, he mentioned that COVID patients with a mild form of infection need not take any steroids. He also stated that taking steroids will increase the risk of secondary infections like mucormycosis, which is very common nowadays. So may I know your opinion on this?
Yes. No, I think you asked the question and you answered the question as well. So the answer to your question is yes, steroids will cause abnormal rise in your sugar levels, because steroids does affect your metabolism in the sugar. So I think the steroids is being overused in many situations. To many people, it is being overused. You must avoid the use of steroids, and you should only go by the guidance of your intensive care doctor. The use of steroids is only in the early phases is useful. In the late phases, in significant cases, there is no use. Steroids depress and lower your immunity even more. So people who take steroids are at risk of all other secondary bacterial infection, renal infection, urine infection, all kinds of infection. So be very cautious. Now the problem is a lot of people have started to ask doctors to give medicines. And doctors are under pressure, especially in smaller hospitals. Doctors are under pressure saying that steroids steroids and the doctor kudukka, because we all panic and start discussing this with family. Namakku therinja doctor, theriyada doctor, Google doctor, ella doctor, online doctor, ella doctor kitte nama idha pathi pesrom. So what happens is you get a lot of mixed information, and so we start telling, because of desperation for a problem where there is no cure. See, if we knew a cure for this disease, we know, okay, the problem is not treatment over. But here we don't know the cure. So we're trying all these things. And steroids is something that we give for a lot of lung problems. So steroids should be used with caution. It should not be used randomly. It will alter a lot of things. It will cause infection. It will alter your sugar, especially if you're a diabetic. And if it is not well controlled, your sugar levels can shoot up very high and become dangerous. So steroids should be avoided. Only given in selective, very similar to remdesivir. Remdesivir role is very, very limited. Remdesivir is not the cure. It should not be given for everybody. So So that's the answer. So steroids should be used in very selective patients. And that, I think, only a doctor should decide.
Yeah. Thank you, sir. Sir, I have one more question. So in recent study, CDC evaluated the incidence of myocarditis in both vaccinated as well as unvaccinated people, especially in boy kids. Is this a mere coincidence, or do we have to take it as a casual association, sir?
Yeah, so I am not an infectious disease specialist, so I would not be able to give you the exact answer to your question. I'm not sure if there is a clear incidence of myocarditis, but myocardial infarction, that is heart attack, or stroke or kidney failure, is noticed and well recognized complication of COVID. And the reason for that is the virus causes clot formation. It causes clumping of the platelets and forms clot formation. So when there's a clot inside a blood vessel, it blocks. So it affects the blood flow to the organ. So because of that, you can get heart attacks. One of the things that we all have heard is after vaccination, this actor Vivek died. And most of us thought that he died because he took the vaccine. It is not true. He had a 90 to 95% triple vessel block. And that is why he died. But we also see patients who had COVID who are recovered, gone home, and suddenly had a heart attack. So that is why now we are checking for the clotting profile like D-dimers and seeing if they have increasing clotting tendency and putting them on anticoagulants. Regarding myocarditis, I have not read, I have not come across it, but I can write to you. If you write to me, I can find out from our doctors and tell you.
Sure, sir. I will. Thank you, sir.
Yeah.
Thank you, doctor. This is Ramya.
Hi.
My question to you is, it was on a personal experience. One of my relatives had COVID and his lung score, CT score was 25 out of 25, but he was absolutely asymptomatic. He didn't have any problems, and he was admitted in the hospital. He was treated for a couple of days. His oxygen levels were fine, and he returned back. He's fine now. So what does this lung CT score imply on the condition of the patient? Yeah. And what are we to reckon from it?
Sure. Yeah. That's a good point. And first of all, one is your relative is lucky. And number two is whichever hospital he went, they took care of him well. So I think it's a combination of two that he is good. The CT score, the lung score, is basically there are many lobes in the lungs, and each lobe is like if you just divide your house into, say, you have 5 rooms in your house. So each lung has, say, 5 lobes. If one lobe is involved, you give a score of 2. If another lobe is involved, you give a score of 2. So by counting how much lobes are involved, you come to a score. So if you have 5 rooms and you give 2 points, if you have 10 is the maximum. If you all rooms there are infection, then it's 10 out of 10. It does not mean 100% of your lung is involved. Yeah, it just means that the disease is spread throughout the lung. Infection. That is what it means. If the entire lung is involved, very unlikely somebody would survive this disease. It is just that all the lobes were involved. That's why they derive at a score. If he was young and if he was a healthy person, he would have recovered. And probably that is what it is. I have also seen a 65-year-old with 24 out of 25 came for a surgery to me. We test everybody for COVID before an operation, and it was surprising that she had 0 symptoms, but she had 24. And she was kept in hospital for 2 days. They were worried about her, but 2 days later she walked home, and she's fine. She came back after a month. We did a spine operation for her, and she's doing fine. So this disease itself is a myth. At the same point, I've also seen people who have had 4 out of 25, reasonably fit and young. Suddenly they die. They are admitted in ICU with infection. So it's a disease that is very specific to an individual person's immunity and body. And also there is a study that has come up saying that the spike protein that is there in the virus, it has a different reaction to certain chemicals and proteins in our body. So if you are deficient of certain things in your body, then you are at a more higher chance of a severe disease than somebody who does not have this. So it is all too technical. I don't know if you have a lot of biologists and people. You're probably more learned people here in this group than I am in terms of this disease. So you probably understand this better. So the key is get vaccinated, protect yourself from the disease. Don't get it because you don't know how this will affect you and it will involve you.
All right. Thank you, doctor. Thank you.
Thank you.
Doctor, we have a few questions in the chat box.
Somebody questions from the
Yes, I'll do that, sir.
please, yeah.
After 2 months of vaccination, that is both the doses, still there are no antibodies in the test done. Why would that be?
Sorry, can you?
After 2 months of vaccination,
Okay.
both the doses of the vaccination, still when a test was done, antibody test is done, there are no antibodies found in the test.
Yes.
Why would that be?
Yeah. So this is again interesting that we probably still haven't understood. People who have had the infection as well as had the vaccination have also had very low titers on their antibodies. So this is again to do with how your body is reacting to that specific vaccine or the protein of the virus. So not everybody forms. People who have had a very mild symptom or people who have had one dose of vaccine, after one dose they have got very high titers. But people who had infection as well as the vaccination have had low titers. So it is very dependent on your body. So there is no scientific reason behind this. So it is how the body, individual reacts to it.
Thank you, sir. The next question is, yes, you may ask, Ramya, ma'am.
Yeah, good evening, doctor. This is Ramya from Ramya Vasudevan. Yeah, continuing with the question that you had actually the answer that you had given is about the D dimer. Is it possible that even though the D dimer markers are pretty low, you can still have blood clots and will be prescribed aspirin for a while?
Yes, you can, even if your D dimers are low, you can still have this. It is only a marker to say if your D dimers are very high, you have an increased chance of developing clots. If your D dimers are low, it does not mean that you will not get clots. Your risk is low. And especially if you are somebody who are old, if you are already had any previous vascular problems, and if your D dimers are low, you still have a risk because you are generally have a higher risk. It is only an guide. It is not that if D dimer is normal, you don't have a risk. So people who are elderly, they sometimes now still ask people to take aspirin or any other anticoagulants for about 4 to 6 weeks. Sometimes even just 10 days they give. There is again no guidelines. There is no international specific guidelines whether we should test the D dimer and put them, whether we should not test it and put everybody on, a short course of antiplatelets and anticoagulants. Nobody knows. But in general, if the D dimer is high, they have a high risk of clot. So it is better for them to go on anticoagulants.
Thank you so much, doctor.
You can continue.
Next question is, could you please tell if a heart patient can be vaccinated or not?
100.
Dad is a heart patient and has also undergone an operation in his kidney. So is it safe for him to have a vaccination?
Yes, if he is not in hospital or if he is not just had the surgery or the kidney problem is not serious and admitted in hospital, if he is known to have maybe an angioplasty or a bypass surgery or he had a kidney failure or whatever, he should definitely have the vaccination.
Thank you, sir. The next question is, what would be the optimum time gap between 2 doses of vaccination?
Okay, so when we started, it was 4 weeks. So when I took the vaccine on the very first slot that came to us, it was 44 weeks. Then it was increased to 6 weeks, and now they say it's between 8 to 12 weeks. So the ideal time now is for both Covaxin, Covishield, and Sputnik is anything between 6 weeks to 12 weeks. So I would suggest just remember around 2 months. So that's the time gap between this. Now, let me answer another question somebody might ask or may not ask. Suppose, say, you had the first dose and then you develop COVID infection. What does it mean? Should I take the vaccine as planned in 2 months, or should I wait? Okay, the answer is, if you had your first dose and if you develop the infection, you still have to wait for 3 months. And the second dose can just be the second dose. You don't need to start all over again. You don't need to again go back to first dose and then second dose. மறுபடியும் second dose மட்டும் போட்டா போதும் after 3 months.
Thank you, sir. The next question is, how long does immunity from COVID-19 vaccination last?
We don't know. We still have to wait for all the research. I mean, this vaccine has only been out in the last 6 months available, and we've been only vaccinating from December worldwide. At the moment, they feel that the immunity will be there for at least a year, 1 year, maybe longer. We don't know if the booster dose will be required, or maybe every year you need to take this vaccine. So there's a lot of research going on. We will know the answers soon.
Thank you, sir. Sir, the next question is, can you tell us about the role of fungi in COVID patient?
Yeah, so I mean, this is the talk now everywhere about the fungal infection. Again, as I said, I'm not an infectious disease doctor, but what my understanding is, and what I've read, and I've discussed this with other doctors who deal with this, people who have had the virus infection have also got the fungal infection. People who have not had COVID have got fungal infection. People who have been on steroids or remdesivir or without have also got the infection. People have got it within 1 month after the COVID, and people have got it after 6 months after COVID. So from the current data that's available in India, there is no specific correlation saying that the COVID is the direct cause for the fungus. Yes, when immunity in your body comes down, for whether it is bacterial, viral, whatever, fungus can attack our body and we can get fungal infections. There's a new theory that is coming up, and which is more of a realistic theory, is because of the masks that we wear. Some of us wear this mask for many days. Some of us keep the masks. You take it out at home, you put it somewhere in the corner, and then you pick up that mask again. You put your mask inside your bag, and after 2 days, you take it out from your bag. So there's a new theory that the mask could be the cause of spread of infection, because the fungus is a porous, so the fungus can sit anywhere, and then you pick it up and it goes in through your nose, and mainly it is in the sinuses. So there isn't any clear relationship that only COVID patients are getting. Everybody in the world is wearing masks, and especially with our hot weather, our masks get humid and it becomes wet, and we keep that somewhere, and when there is humidity, when there is dampness, fungal infections do come. So I think this is a new theory that's coming up. But yes, there is also a relationship that when you have high dose of steroids, when you are having COVID, your immunity is low and you're getting the infection, because we're also using a lot of masks in the hospital, whether the masks are sterilized well and used. So these are all so many theories coming up. So I think you need to be very careful with this fungal infection, and hygiene is very important.
Thank you, sir. The next question is, speaking of building immunity, are the vitamin C, D tablets and zinc tablets safe? What is the frequency on which these tablets should be taken?
So the vitamin D is something that is very essential for our body. They say vitamin D is the cause of many disease, from heart attack to cancer to bone disease to osteoporosis, skin problems, all kinds of things. Vitamin D is freely available in India, but we don't take it. It's there in the sun, but we all hide from the sun. So vitamin D should be good for immunity as well. So you need to take 1,000 units per day, so single tablet. Or if your vitamin D levels are low, you can take it once a week, 60,000 units. so you can see your doctor or get a prescription. Now, zinc, vitamin C, multivitamins, vitamin B complex, all these things are daily dose. You can take it for 3 months. There's no harm. Very, very rarely, hypervitaminosis can cause harm. That is, taking excessive vitamins can harm the body also, but it is extremely rare. So feel to take vitamins, but நம்ம சாப்பாட்டிலே எல்லாம் இருக்குது. The problem is we don't want to believe that our Indian food is the most well-balanced food compared to Western food. But problem is we eat more Western food than Indian food. So our food has everything. But when in this season, in this time, especially if you are having COVID, taking supplements for up to 2 to 3 months is fine. So you can just take just 3 months.
Thank you, doctor. The next question is, can one dose of Covaxin and the second dose of Covishield be taken?
No. They are both, especially different ways in which they are produced. You cannot take two different vaccines. So you cannot mix and match.
Thank you, Dr.
Rahita, I have one question. So, are there any possible risk of vaccinating people with optic neuritis or multiple sclerosis or any central nervous system associated diseases, especially in others?
No, not that I'm aware of. No.
Okay. So, is it safe, sir, to get them vaccinated?
Safe. Yes.
Okay. Thank you, sir.
Yeah.
If there are any more questions, you may either unmute and ask, or you may post it in the chat box. I think that's it, doctor. We don't have any more questions. Thank you very much for the so informative session. Thank you so much for taking out the time from your busy schedule and sharing this much needed information with us. We got to know a lot about COVID-19. A lot of our doubts were clear. A lot of myths were, busted, and we got to know a lot about vaccinations and about rehabilitation. On behalf of the management, principal, and all the staff members of Dr. M.G.R. Janaki College, express my heartfelt gratitude to you. Thank you.